This is The Week in Addiction Medicine, a podcast resource of timely news and top stories brought to you by the American Society of Addiction Medicine, ASAM.
Today is Tuesday, July 28th, and I'm Zach Caruso. Our lead story this week is in BMJ Open and is titled Association Between GLP-1 Receptor Agonists and Alcohol-Related Hospitalizations Among Adults with Alcohol Use Disorder, Multi-Target Trial Emulation Study. This retrospective cohort study using target trial emulation evaluated the association between use of newer glucagon-like peptide 1 receptor agonists and alcohol-related hospitalizations among adults with AUD and type 2 diabetes or T2D or obesity. The authors found that among adults with AUD and T2D or obesity, initiation of newer GLP-1 RAs was associated with a lower observed risk of alcohol-related hospitalization. Next is an article in JAMA Network Open and is titled Availability of Naloxone in Retail Pharmacies Following Introduction of Over-the-Counter Status. This national cross-sectional secret shopper study examined over-the-counter or OTC naloxone availability from January to April 2024. Same-day OTC naloxone was available in 61% of pharmacies. However, 58% of those pharmacies reported it was behind the pharmacy counter. The mean cost of OTC naloxone was $52. Corporate chain pharmacies were more likely to carry OTC naloxone than pharmacies classified as food or mass merchandisers, independent or medical affiliated. Our next article is in Substance Use and Misuse and is titled Assessing the Acceptability of a Wearable versus Implantable Device for Overdose Detection and Naloxone Administration, Perspectives from Individuals in the Addiction Workforce and Individuals with a History of Opioid Use. This survey-based study assessed the acceptability of a wearable versus implantable device to detect and prevent opioid-related overdose. A total of 60 individuals who use opioids and 126 individuals in the addiction workforce were surveyed in a Midwest city. Both groups found the wearable device to be more acceptable, as did participants with a history of overdose and those who reported use of MOUD and intravenous opioid use. Among those in the addiction workforce, device acceptability was associated with less stigmatizing views of harm reduction. Our next article is in Drug and Alcohol Dependence and is titled Association of Route of Drug Administration with Self-Reported Non-Fatal Overdose, a cohort study of Baltimore City adults who have injected drugs. Since the COVID pandemic, there has been a shift from injection drug use to other routes of administration. This study investigated how non-fatal overdose risk changed during periods when individuals used various routes of administration. Researchers used data from a previous study of AIDS and injection drug use in the Baltimore area. For heroin use, using all three routes had a higher overdose risk than only injecting, only nasal inhalation, or injecting and smoking. For cocaine use, compared to injecting only, odds of overdose were higher for injecting and nasal inhalation or smoking and nasal inhalation. The authors conclude that using drugs by multiple routes of administration carries a higher overdose risk than use by a single route. They speculate that those using a single route are better at estimating dose and perfecting safety practices. Next is an article in the Substance Use and Addiction Journal titled The Decision to Not Carry Naloxone Among People Who Use Drugs in Rhode Island, a Mixed Methods Analysis of Harm Reduction Surveillance System Survey Data 2021 to 2024. While efforts have been made to increase access to naloxone, people still often don't carry it. To better understand why, researchers conducted a mixed methods study among people who use non-prescribed substances. Researchers found that overall, 60% of those surveyed currently had naloxone with them, but the rate was higher among those reporting opioid use versus those using non-opioids. Of note, 54% of those not carrying naloxone had witnessed an overdose in the previous 12 months, and 20% had experienced one themselves. Reasons given for not carrying naloxone included not feeling personally at risk, stigma against those who injected substances, not wanting the responsibility of carrying it, or potential consequences such as negative police interactions. The researchers note additional efforts are still needed to reduce stigma and increase education. Next is an article in Addiction Science and Clinical Practice titled Analysis of the Costs and Reach of Transportation Services to Reduce Barriers to OUD Treatment, Evidence from the Kentucky Healing Community Study. Initiation of and retention in treatment with MOUD continues to be low, and transportation is an often cited barrier. A Transportation Assistance Program, or TAP, was implemented as part of the Healing or Helping to End Addiction Long-Term Community Study, or HCS, in Kentucky. 8 counties were included in the analysis, and the overall cost of the program was $437,000 in 2023. The urban counties accounted for 73% of the costs, covering 75% of individuals reached by the program. The average cost per person was $53 in urban counties and $61 in rural counties. Of note, while rural counties provided TAP to 24% of individuals in the program, they only accounted for 6% of the overall population, highlighting the significant need for transportation in rural areas. Next is an article in Drug and Alcohol Dependence titled Mapping and Measuring Addiction Recovery, Recommended Protocols Through the Phoenix Toolkit. The Phoenix, or Phenotypes and Exposures, is a directory of standardized measurement protocols allowing data to be compared across studies. This paper describes the Phoenix Substance Use and Recovery, or SUR, working group and the process of developing a toolkit for measuring recovery. The group developed a set of 15 protocols that measure various aspects of recovery from substance use disorders over 3 domains: biopsychological, socioecological, and treatment and recovery services and satisfaction. They anticipate ongoing work to refine and potentially expand the group of protocols. Our final article is in JAMA Network Open and is titled Problematic Social Media Use and Attention Deficit/Hyperactivity Disorder Symptoms in Adolescents. This cohort study of 11,000 youth participants assessed if within-person changes in problematic social media use, or PSMU, among youths was associated with attention deficit/hyperactivity disorder, or ADHD, symptoms across 5 annual study waves, and do these associations differ by sex. Researchers found that within-person elevations in self-reported PSMU behaviors were associated with higher parent-reported ADHD symptoms the following year during mid-adolescence. These within-person associations differed by sex and were significant among males but not females. The findings suggest that assessment of social media use among youths with ADHD should prioritize problematic patterns and consider sex-specific risk. This concludes today's episode of This Week in Addiction Medicine. Remember to subscribe to the ASAM Weekly for more exclusive content and our editor's commentary delivered every Tuesday. Be sure to check us out on social media and at asam.org. Thanks for listening. We'll be back next week.